Welcome to study session 3, Serving and feeding the client with diet. Introduction. Serving of client's diet is a nursing intervention directed towards meeting the nutritional needs of clients in the hospital and also to promote optimal nutrition, while feeding of clients with a served diet is a nursing intervention directed towards assisting clients who are unable to feed themselves in order to meet their nutritional needs. In this study session, you will be learning about the nursing actions and rationales involved in serving and feeding of a client. Learning outcomes. When you have studied this session, you shall be able to identify the nursing actions involved in the serving of client's diet. Identify the nursing actions and rationales involved in the feeding of client. Serving of client's diet. Serving of client's diet is a nursing intervention directed towards meeting the nutritional needs of clients in the hospital and also to promote optimal nutrition. Assessment. As part of the client's admission protocol into the ward and subsequently, the client's nutritional assessment should be carried out to obtain information on the following. 1. Food preferences, allergies or restriction to diet. 2. Diet history in relation to food and fluid intake. 3. Weight and other signs of nutritional deficiency, for example, inflammation of the mouth, sparse hair, and so on. 4. Medical or surgical health problem associated with food and fluid intake and nutritional requirements such as difficulty in chewing and swallowing, constipation, diarrhea, and so on. 5. Medication history to determine if medication will be administered before, during, or after meal. Also to determine the possibility of food-drug interaction. 6. Physical activity level to determine the level of assistance needed. 7. Prescribed food order. Nursing diagnosis. Imbalanced nutrition, more than body requirement. Imbalanced nutrition, less than body requirement. Risk for imbalanced nutrition, more than body requirement. Plan. Requirements. A tray containing the prepared diet, food utensils, for example, spoon, table knife, fork, and straw for drinking, a cup of drinking water or any other client's preferred fluid choice, such as juice. Implementation or action. Procedure. 1. Inform client about the arrival of diet and assess the client's readiness to eat. Rationale. To prepare the client's mind about diet and to determine when to serve the client's meal. 2. Wash hands. Rationale. Reduce the risk of transmission of microorganisms. 3. Instruct and assist clients to wash hand in preparation for eating. Rationale. This promotes patient comfort and also reduces the risk of transmission of microorganisms. 4. Remove any unpleasant visual stimuli such as bedpans and urinal in the client's surroundings. Rationale. Unpleasant sight and smell can decrease a patient's appetite. 5. If not contraindicated, raise the head of the patient's bed or instruct and assist the client to sit in a chair. Upright position reduces the risk of aspiration and reflux. 6. Check and ensure that the diets correspond to the prescribed order. Rationale. This ensures that the clients take the right type of diet. 7. Arrange food in a tray with required feeding utensils and fluid choice and place on the overbed table or in a manner convenient for the clients to eat. Rationale. This promotes comfort and brings the food close to clients' easy access or reach. 8. If required, assist the clients to cut food to smaller pieces. Rationale. This provides necessary assistance needed with food. 9. Allow the client to make choices about the order in which the food is eaten, the speed at which the food is eaten, and the amount of food that will be eaten. This facilitates client independence. 10. Do not hurry the patient through the meal. This may facilitate client's enjoyment of the food. 11. Communicate with the client in the course of the meal. This is optional, but not on stressful event. This improves interpersonal relationship, while discussion of stressful life events at mealtime can depress appetite and delay digestion. 12. Encourage the client to eat if you observe that the client is not eating the meal as required. This improves client's appetite and food consumption. 13. Remove the tray when client is done with the meal. 14. Encourage the patient to remain in sitting position for at least 15 minutes after meal. This decreases the risk of reflux and aspiration. 15. Assist the client to clean up after meal with hands and other body parts as required. This helps to promote client's body comfort. 16. Wash hands. This reduces the risk of transmission of microorganisms. 17. Record the time, type, amount of food, and tolerance to food. Evaluation. Carry out an evaluation of the client on the following. 1. Tolerance to feeding. For example, nausea, cramping, and satisfaction with meal. 2. Regurgitation and feelings of fullness after feedings. 3. Weight gain or loss. 4. Fecal elimination pattern. For example, diarrhea, flatulence, constipation. 5. Hydration status. For example, skin toggle. 6. Urine output and specific gravity. Relate findings to previous assessment data if available. Report significant deviations from normal to the physician. So far you have been taken through the nursing actions involved in the serving of client's food. It is anticipated that in your next clinical placement, you should be able to carry out this procedure. Feeding of client. Feeding of client with a SEPT diet is a nursing intervention directed towards assisting clients who are unable to feed themselves in order to meet their nutritional needs. Assessment. As part of the client's admission protocol into the ward, and subsequently, the client's nutritional assessment should be carried out to obtain information on the following. 1. Food preferences, allergies, or restrictions to diet. Diet history in relation to food and fluid intake. 3. Weight and other signs of nutritional deficiencies. For example, inflammation of the mouth, sparse hair, and so on. 4. Medical and surgical health problem associated with food and fluid intake and nutrition requirements such as difficulty in chewing and swallowing, constipation, diarrhea, and so on. 5. Medication history to determine if medication will be administered before, during, and after meal. Also to determine the possibility of food-drug interaction. 6. Physical activity level to determine the level of assistance needed. 7. Prescribed food order. Feeding of clients with a SEPT diet is a nursing intervention directed towards assisting clients who are unable to feed themselves in order to meet their nutritional need. Serving of client's diet. Assessment is an important phase of nutrition-based intervention. Serving of client's diet. The food must be prepared and presented in an appealing or attractive manner to the client's senses. Unpleasant visual stimuli and stressful life events must be avoided during the course of eating. Nursing diagnosis. Imbalanced nutrition, more than body requirement. Imbalanced nutrition, less than body requirement. Risk for imbalanced nutrition more than body requirement. Plan requirements. 1. A tray containing the prepared diet. 2. Feeding utensils, spoon, table knife, fork, and straw for drinking. 3. A cup of drinking water or any other client's preferred fluid choice, such as juice. 4. A bowl of water to wash patient's hands, napkin or paper serviette. Implementation or action. Procedure. 1. Inform clients about the arrival of meal and assess the client's readiness to eat. To prepare the client's mind about diet and to determine when to serve the client's meal. 2. Explain feeding procedure to the client and determine the level of client participation to facilitate client cooperation. 3. Position the patient comfortably, if not contraindicated, position client in Fowler's position. To promote comfort and Fowler's position reduces the risk of aspiration. 4. Assist the client to wash hands in the bowl containing water. This reduces the risk of transmission of microorganisms. 5. Place napkin over chest and around the neck. Optional. This prevents client's clothes from soiling. 6. Check and ensure that diets correspond to the prescribed order. This ensures that the clients take the right type of diet. 7. Create a pleasant environment by removing any unpleasant visual stimuli. This enhances client appetite. Wash hands. This prevents cross-infection. Arrange food in a tray with required feeding utensils and fluid choice on the overbed table or in a manner convenient for the nurse and client. Stand or sit at the side of the client. 10. Allow the clients to make choices about the order in which the food is eaten and the amount of food that will be eaten. This enhances client cooperation and independence. 11. Feed the client in small bits using an appropriate feeding utensil. For example, spoon. Wait for the clients to chew and swallow the food before the next. Taking the food in small bits at a time helps for effective chewing and reduces the risk of aspiration. 12. Give water in between if clients prefer. This relieves obstruction, if any, and helps in swallowing. 13. Encourage the clients to eat, but do not use force. Forcing the clients to eat may cause vomiting. 14. Encourage the client's participation in the feeding procedure as much as possible. This facilitates client independence. When client is through with food or feels satisfied, stop feeding and give water if client prefers. 16. Clean up the client's lip with napkin or serviette and wash hand if required. This promotes comfort. 18. Record the time, amount, and tolerance to food. If client is on intake and output, monitoring, record the amount of fluid taken in the VO chart. This ensures accurate documentation. Evaluation. Carry out an evaluation of the clients on the following: tolerance to feeding, nausea, cramping, and satisfaction with meal, regurgitation and feelings of fullness after feedings, weight gain or loss, fecal elimination pattern, diarrhea, flatulence, constipation, hydration status, skin toggle, urine output and specific gravity. Relate findings to previous assessment data if available. Report significant deviations from normal to the physician. So far you have been taken through the nursing actions and rationale involved in feeding of client 7. It is anticipated that in your next clinical placement you should be able to carry out this procedure. Summary of Study Session 3. In Study Session 3, you have learned about the nursing procedures and actions in relation to the serving of client's diet, the different rationales behind nursing actions in relation to the serving of client's diet, the nursing procedure or actions in relation to the feeding of client, 4. The different rationales behind nursing actions in relation to the feeding of clients. Assessment is an important phase of nutrition-based intervention. Serving of clients' diet. The food must be prepared and presented in an appealing or attractive manner to client senses. Pick 2. Unpleasant visual stimuli and stressful life events must be avoided during the course of eating. End of study session 3. Thanks for listening.